to do a speech, informative speech on knee injury. Bethany, Jordan, and John. There's 35 seconds left in the game. You receive the basketball at the top of the key. You make your move, and within 2 seconds, your world has come crashing down. If any of you play sports, you know this feeling. Being at the top of the world, the crowd cheering your name, and before you know it, it's all taken away from you due to an injury. Sport injuries are a serious matter. I have experienced more than my share of this statement, especially in my sophomore year of high school. I will be sharing a personal experience with you today about the structure of the knee, the surgery process, and the rehabbing workout. First, the knee is the most complicated and most injured joint in the body. There are 4 major bones in the knee: the patellar, which is your kneecap, the femur, which is your thigh, the upper part of the leg, and the tibia and the fibula, which consist of the lower part of the leg. There are 4 major ligaments in the knee: the ACL, the MCL, the PCL, and the LCL. The ACL is the anterior cruciate ligament. It is located in the center of the knee, and it limits rotation and the forward movement of the tibia. The PCL is the posterior cruciate ligament. It limits the rotation of the backward movement of the tibia. The LCL is the lateral cruciate ligament, and it holds your knee, the outer part of the knee, from moving side to side. And the MCL is the medial cruciate ligament, and it protects the medial side of the knee from moving side to side. Now, surgery is the best route, but it's not exactly necessary. There are 5 different tendons and grafts that they can use. There's the patellar tendon located across the kneecap, the hamstring, a donor of both of those, and your other leg with using those ligaments as well. Now, the grafts that they can use are the arthroscopic. There's little holes going in with a needle and just cleaning up, simple work that way. If you're more serious, there's a cut along the side of the leg, easier to get to the hamstring. And if they're going to use the patellar tendon, it's easier to make a big incision across the knee and down the leg. There are different stitches that you can be used as well. One is the continuous suture. That's where it's done on the inside of the leg, and it weaves back and forth, and both ends come to the top. And in order to get those out, one pull, and they slowly come out of the knee. The second is the absorbable. They're done also interior, and those just eventually dissolve. And there's the non-absorbable, and they're the external, and those you snip individually and then pull out. Lastly, you are to stay in the hospital overnight, and once released, you are to attend rehab. There's around-the-clock care the first night, which is necessary. You're in a lot of pain, and there's increased complications coming out of a surgery like this. The dressings need to be changed at a routinely hour because of infections. And once you're released from the hospital, you are to attend rehabbing in order for a source of healing. It's the only way to heal, otherwise things grow short. In conclusion, you have been informed about the structure of the knee, the surgery process, and the rehabbing process. After 2 years of rehabbing, 3 surgeries, and several doctors later telling me that I would never walk again, I came back and played the best senior year of my life. My future of ever playing college ball was over, but at least I overcame the odds. And so you can see sports injuries are a serious matter.